Hi, welcome. We're going to be talking about the sting and apiary safety. My name is Laurene Keil. My background as a beekeeper has been about 12 years, a little over. My professional background is as a registered nurse with a BSN. I also have a master's degree in nursing in clinical nurse specialist and nurse manager. And I went on and got a additional master's degree as a nurse anesthetist, which I've been doing for the last 21 plus years. Prior to that, I worked in an intensive care unit. Why did I choose this as a topic? Primarily because as beekeepers, we're not taught a whole lot about safety. It's kind of the background thing, but we've never really, in my experience, and I'm a continuing education kind of girl, we don't talk a lot about the safety thing, especially with relation to what stings are and what they can mean. And for this reason, I've decided to address this topic. We can talk about the basic apiary safety, and that includes how you access your apiary with the topographical concerns, how you get to it, how you're able to work your bees. You might talk about some of the biomedical concerns, which primary is lifting, and supers can get very heavy. It's a lot of stooping and lifting, and these are some basic safety concerns. Additional equipment may be needed to make it easier for you to work your hives. And by that, I'm talking carts, gators, potentially something to help lift. It may also mean a helper in your apiary. Additionally, smokers are hot. They are a fire hazard, and many a beekeeper have started potential fires on their carts or in their hive area. There are also the chemical hazards, which are primarily your mite treatments that you need to be cognizant of. But these aren't really the concerns I'm going to address on a huge amount in this presentation. My goal here is to understand the mechanism of the sting, and that includes covering some of the components of venom. I want you to be able to differentiate between a normal versus an abnormal or emergency anaphylaxis reaction. And you need, as a beekeeper, to consider the risks of beekeeping. Consider what you can do to prevent problems from the sting. And I want you to understand some basic reading of the hives to avoid problems with sting. Additionally, you need to know, as a beekeeper, when you need to call 911 when you or a fellow beekeeper needs to get emergency help. We always get asked when we start beekeeping, or you tell somebody what you do for a living or a hobby, that you're a beekeeper. They want to know if you're going to get stung. Yeah, honeybees sting you, and they really don't want to do it because they're sacrificing their life for you. How you approach your hive makes a huge difference in stings. And obviously, we've all told genetics play a big role, which is part of the reason we try and keep down the bee genetics from the killer bees, aka Africanized bees. Obviously, we all know this, and this is just review. A worker bee stinger is barbed. It includes a sliding mechanism where the stinger, which is attached to a venom sac, is ripped from the body when she stings you. The venom sac continues to pump even when it's detached from the worker's body. And with each sting, you have been marked with an alarm sent. That worker dies, and that worker sacrifices for colony defense. The mechanism of the sting is essentially a barbed stinger. This is a really cool magnified view of the stinger with a honeybee who has its guts pulled out when that stinger is in the victim, and that means you. And as that bee stings, the blades alternate and it scissors into your flesh. It kind of acts like a screw anchor, meaning once it's in, the stinger can't be retracted. The muscles that are connected to that stinger to the venom sac pumps that toxin in as long as that stinger and the venom sac is attached to you. Again, a schematic of how that sting buries it into the victim. It works as a scissoring method, and it has a kind of hardened plate behind it, a stylet, that keeps the whole thing fairly rigid when it's injected into you. And again, another schematic. The stinger mechanism consists of that serrated blade that's digging into you, that stabilizing rod behind it, and not only a muscle is ripped out of that worker bee's body, but the venom sac, and it continues to pump into you to deliver that venom into that victim. Obviously, we know that queens and drones have a slightly different stinger. The queen stinger is not detached when she stings you. I was always told it was not barbed, but the information I received and when doing this research is that it is barbed, but it is not as barbed as a worker bee. So she's able to sting multiple times without ripping out her body parts. And obviously that's used in defense and fights with other potential queens. The drone, because it is male, does not possess a stinger. Only the females do, because it's an adapted female organ used to deposit eggs in the bottom of the cells. What's in bee venom? The majority of it is mainly water. Its pH range from, and obviously you can read this, about 5. It also has 63 components, which I am not going to review. Primarily, these 5 components are of interest to us, and I want you to take a look at, these are all listed as dry weight, but take a look at some of the things these components actually do to add that toxicity to the venom. The first one causes red blood cell rupture. It causes the vessels to dilate, which cause not only pain, but potentially can cause a drop in blood pressure. There's some phospholipidase, A2, which causes destroyed cell membranes and pain and inflammation. Of particular interest to me is the histamine, which composes about 9% a dry weight. And histamine causes those capillaries, which are the smallest blood vessels in your body, to leak fluid, causing pain and itch. Remember that 9% of histamine, because it's going to be important as I talk a little bit later. And again, we get items that destroy the nerve tissue and also a component that causes the reaction to spread by diffusing the whole toxic cascade, as it might be known. This was a good article by Riddle, and it was in Bee Culture. The usual response to an insect sting is, of course, we're not real happy to have a sting occur on our watch. And when we first get stung, when we're beginning beekeepers, usually we have this type of reaction. But in a medical sense, responses to the sting are graded according to the magnitude of the reaction as either moderate, mild, or severe. And additionally, those responses to the sting, and by this I mean your body's response to the sting, can be characterized as either a normal reaction or a not normal reaction. If it's normal, it's considered localized to where that sting has happened. If it's systemic, it occurs in an area far removed from where that stinger was placed in your body, and it's not normal. The best research I could find says that about 25% of the population can have large and localized reactions. But a severe reaction, which is called anaphylaxis, or a severe reaction to a sting, has about a 25 to 65% of a truly life-threatening reaction called anaphylaxis with that next sting. And though I did not see real numbers for how beekeepers fall in that time frame, my assumption would be, and we know what we say about assumptions, would be that beekeepers have a higher risk to a more severe reaction because of our exposure. What's a normal reaction to the sting? And again, we're talking about a localized reaction to that sting. And it's graded. It may occur and show as redness, heat, swelling, itching, or pain. If it's mild, it usually resolves in a few hours. A moderate reaction may have that redness or swelling enlarge over days with a resolution in 5 to 10 days. While it's still considered a normal reaction to a sting, it may not go away in the first couple days. So it shouldn't be a surprise to anybody that you may have a reaction that lasts a little bit longer than those people who have been beekeeping for a long time and said, 2 days and it was gone, or a couple hours and it's gone. This is the pictures of horror, which essentially are mild to moderate responses to stings. They're localized, they're in that area where the sting actually occurred. That may not mean it's a small area where you're swelling. It may be that whole eye, it may be an entire fat lip. It may be that you have mitten hands, as shown in that lower picture on the left. And sometimes that swelling will increase over 2 to 3 days. Some medical individuals mistake it for an infection, which it is not. It's an inflammation response. Infections are rare with bee stings. What do you do with a minor sting reaction? The immediate thing you do is to remove the stinger, scrape it out. You obviously don't want it giving the entire possible dose that you can get from it staying on board and continuing to pump. The treatment is symptom oriented. All these things I'm discussing now actually are over-the-counter medicines. Obviously, I'm not a physician. I cannot prescribe medication, but I'm telling you what I do, and I'm telling you some of the things that we use in the operating room if I was concerned about you having an allergic reaction. These are some of the same type of drug classes I would use, but what I'm suggesting is potentials that you can buy over the counter to use with a sting. And these are primarily over-the-counter antihistamines. Remember that one of the components in venom was histamine. Additionally, a normal body response to an irritant that includes an injected venom is an inflammation response. And an inflammation response releases histamines from the destroyed cell. It's a way for the body to say, hey, something happened here. I'm going to swell, I'm going to bathe that area in white blood cells and try and take care of the problem. Antihistamines are classed primarily in two ways. And here I have it listed as histamine 1 and histamine 2 antihistamines. You can actually take both histamine 1 and histamine 2 antihistamines at the same time. What I'm cautioning you to do is make sure you have them in your to-go to the bee yard bag or in your medicine chest or where you can get to them very quickly, but you need to make sure you are medically able to take antihistamines before you ever need them. And by that, you can easily look on the label of what I'm going to say I keep in my medicine chest. So be sure you can take it before you actually ever pop the pill. You can also take an over-the-counter pain reliever. This would be things like Motrin or Tylenol. That's essentially for the swelling and the pain. The recommendation is to avoid aspirin. Aspirin can increase the risk of bleeding. And again, when we refer back to the venom components, some of them destroy red blood cells. So you don't want to add another drug that can cause bleeding. You can ice or cold compress the area, and you can use topical ointments, hydrocortisone or calamine cream. If your symptoms change, and by that I mean if they go from a localized reaction, a reaction in the general area where you were stung, to something far removed, that now becomes a medical emergency and you need to call 911. What I'm going to discuss here next is how you differentiate when things go from, okay, I got a bunch of stings, to worse. And sorry, I should say that's in a slide or two. Here's the over-the-counter histamine 1 and histamine 2 blockers, which is what antihistamine is. Histamine 1 blockers are primarily used for seasonal allergy type things, and that includes Benadryl, which can be anywhere from 25 to 50 milligrams that can be taken every 4 to 6 hours. Some people have problems with Benadryl making them sleepy, and oftentimes that's the 50 milligram dose. 25 milligrams may or may not bother you. If it does, don't take Benadryl. Claritin or loratadine, which is a 10 milligram dose, is a 24-hour type for seasonal allergies, for pollen allergies, and they're pretty safe profile. Zyrtec also is a seasonal allergy medicine, and they can both be taken once a day dose. Histamine 2 blockers, H2 antihistamines, are listed there on the right. They are first generation drugs that were primarily used for blocking the acid secretion in your stomach, which is a histamine 2 site. So you can actually take Pepcid, 20 milligrams, or Tagamet, 100 to 200 milligrams, as a histamine 2 blocker. Zantac is currently off the market. There were some carcinogenic concerns. I think that was within the last 2 years. So even though that's a first generation histamine blocker, you cannot find that. What do I suggest for taking for the histamine 1 and histamine 2 blockers? I actually dose myself if I get facial stings with not only the Benadryl along with a Claritin, or you can substitute Zyrtec. I take Benadryl, Claritin, and I take a Pepcid. It blocks the histamine release, not only from that venom, but also from the inflammation response for when that stinger is in you. This is very similar for what I do in the operating room prior to I need to expose somebody to something they're allergic to. This would be an IBP dye study, for instance. I pre-dose people to prevent that allergic response, that histamine response with similar products, and I use about 3 of them. Again, I caution you, if you decide to take this route with the dosing, make sure you've checked off all the boxes and read the precautions on these medicines, and hopefully never use it before you ever need to take it to cut down on your response to a sting. Now let's kind of move from normal treatment of a localized reaction to a sting to more serious reactions to stings. And these are reactions to the whole order of insects that honeybees are a part of, which also includes ants and wasps. About 3 to 5% of adults and about 1% of children have severe allergic reactions to this group of insects. This is the part I don't really know what that percentage is for beekeepers, because I couldn't find anything that broke down adults, non-beekeepers with beekeepers. I'm assuming, again, assuming it's a bad word, that beekeepers, because of what we do, we probably have a slightly higher incident to severe allergic reactions, and that's just because we work with bees. When you're talking about an allergic reaction, you're actually talking about an IEG-mediated allergic reaction. And that's where that venom is considered an allergen. It requires a prior exposure, but the next time you're exposed, it causes a severe reaction in your body with a tremendous release of histamine. And remember, histamine's in the venom, but now your body is also releasing histamine because you're allergic to that type of bee, that type of wasp, that type of ant. And it can cause some potential fatalities. This is the definition of anaphylaxis. Please note this form of allergic reaction does require an exposure prior to that particular item that acts as an antigen that your body releases the histamine to. And it may be a food, it may be a drug, it may be venom. It releases those IgE antibodies and sensitizes the host. That second exposure releases crazy amounts of histamine with life-changing consequences. It's potentially life-threatening. It is usually rapid onset. You've all heard of the people with peanut allergies or shellfish allergies, and other particular antigens may include drugs or X-ray dye, which is when I pre-treat in the operating room because you need that contrast for the study or the operation. Also, latex sensitivity, even though it's less prone presently to be latex because we've gotten rid of latex gloves for multiple years, but also insect stings. And there's probably about 40 to 50 deaths attributed in the US to insect stings. Remember, this particular 40 to 50 deaths does not include numbers of individuals that have a severe anaphylactic reaction, is just who died. This is probably the most important slide on this page that says, just because you've had a bad reaction to a sting, Doesn't mean you can't develop one in the future. And when I read social media, the part that really disturbs me is people saying, well, I've never had a reaction. That's great. But that doesn't mean you can't develop an allergy to something that you've been working bees for years and years and years and suddenly develop bad reaction. Additionally, and what I want you to remember, it's important to remember that the potential increase in stings can be as dangerous as an allergic reaction. And that's the problem with killer bees, Africanized bees. They tend to empty a hive out on that poor individual, and the tolerance to the venom is the problem. It's not that you're allergic to it. It's just that you have received so many multiple stings that it kills that person or that dog or that animal. Remember, it's true also of a non-Africanized honeybee because you've been marked with venom with that pheromone, that alarm pheromone with every sting. So you could potentially have a episode of severe histamine release and problems with drop in blood pressure with multiple stings. The best guess I found in research is the tolerance is probably about 10 stings per body weight per person. And obviously, the smaller the person is, the less body weight, or if they're a child, they can tolerate less pure numbers of stings per their pound of body weight. If you remember nothing else, please remember this slide. What are the signs of an anaphylactic reaction? Remember, it's systemic, and it usually occurs within 10 to 30 minutes, sometimes a lot sooner than that, sometimes almost immediately, sometimes later than that. Just a guideline, ballpark figure. Usually you have a rash or hives that first show up. That picture on the left and in the middle shows essentially hives which are a raised red and rash. You may have problems breathing, itching, a runny nose. You may have tightness of the throat, not a good sign. You may have signs of nausea or abdominal pain, or you may be dry heaving or vomiting. And oftentimes, if you have problems with breathing, you get a sense of doom. The woman on the right-hand picture, you can see that her chest and neck area is kind of red and rashy. She probably got stung on the face, but obviously I don't know. But her lips are extremely swollen. That one side of the face is extremely swollen. And I would suspect she's having issues with feeling that she can't get her breath and breathing. The most severe cases of this systemic reaction or anaphylaxis affect both the respiratory and the cardiovascular system. You have problems with closure of the airways. The drop in blood pressure is actually the anaphylaxis, and that's due to histamine release. It causes those blood vessels to basically open up as wide as they can, and you do not have the blood volume to fill pipes that have suddenly gotten bigger, and your heart can't pump limited fluid, meaning blood, to all the organs, and you're not perfusing your body. It's anaphylactic shock, that's drop in blood pressure. The main cause of death with this would be related to airway obstruction and the cardiovascular collapse, which is the pump failure of the heart, and into the wide open blood vessels. Rarer occurrence include, it's called DIC, but that is a coagulation problem where you cannot prevent bleeding. And apparently also, and it makes sense, epinephrine is used to help prevent the problem with the shock. And occasionally a cause of death is it's so bad they've used so much epinephrine to try and give you a blood pressure again that it's an overdose. I know this is not one of those fun little presentations, but again, I think it's serious enough to talk about. Again, you may have an individuals that are showing these symptoms or outward look. They may be gasping for air, they may be wheezing, they may have a higher pitched voice because they're breathing through a narrow vocal cords. They may vomit. They may have a heart rate that's tachycardia high. That heart's trying to keep up to pump blood. They may faint. They may flush. They may be sweating. Not a good look for anybody. How is this anaphylactic shock treated? Normally, if somebody knows they have a true allergy, they're carrying around an epinephrine pen, also known as an EpiPen. You need to call 911 if you or somebody else you're in the apiary with shows these symptoms. It's a medical emergency. It can kill you. You need to remove the stingers. Again, we talked about that as cutting down on the volume of venom you've received. And again, it's got all those wonderful components, those 5 little components that I chose to talk about. If you're the one with the stings or having the problems, can you get away from the apiary? Can you close up the hive? Can those first responders that you called 911 about find you? Can they get to you? When the first responder gets to you and they're administering emergency treatment, they're probably going to give you more epinephrine. They're going to start an intravenous and give you fluids. Again, remember what histamine does. They're going to give you oxygen. They're probably going to give you more antihistamines if you didn't dose yourself, but they will anyhow. They probably will give you some sort of breathing treatment. They'll give you steroids to help prevent the problems with it. And you're probably you're going to the hospital. There's no probably about it. You need further emergency care. If you happen to be the one having a serious reaction to a bee sting, what do you do about it? Obviously, you can quit beekeeping. I do know some beekeepers that are allergic to bees, and they carry an epinephrine pen. They also are full suited, gloves all the time, taped openings, and they still keep bees. I'm not sure I would do that. Additionally, can consult with an allergist and consider whether or not you want to go through a desensitization treatment, which is a lifetime commitment to be able to maintain the body not reacting to bee stings. How do you avoid that ambulance ride and a whole lot of money and potentially losing your life? Not only you do the things that I said with medications, but I think you do something that I'd like to call reading the hive. You want to prevent potential incidents of stinging versus doing a treatment. Prevention is always better than treatment. And here's just a few little basics I put together that we all know, but we sometimes forget. You need to consider before you go into that hive, the size of the hive. Different hives behave differently. Nooks are usually pussycats compared to a hive that's 6 or 7 levels. The time of year that you're going into the hive makes a huge difference. They're so happy in spring and they get kind of snarly when things are shutting down in the fall and there's just not the resources coming in and the days are getting shorter. The time of day obviously is important to decrease the amount of stress you cause to that hive. You want a time of day where most of the older foragers are out and about, not hanging around the house. Older foragers apparently have a higher and more toxic venom load than younger nurse bees. Nectar flow plays a big part in how those hives react to you getting into them. And obviously, when times are aplenty, they're happier bees versus later in the year. Like we're getting into winter here and they're just not as happy. Or during dearth. The weather, when you choose to go into those hives, plays a role. You obviously don't want to go into a hive when they're predicting rain and the rain's falling and the skies are gray and it's just looking nasty because everyone's home and you got a full workforce to deal with. Your previous interactions with the hive play a big role. If you were slamming stuff around and you killed a lot of girls and you didn't use smoke, they're going to remember you and not be so happy the next time with you. Also, your personal factors, and by this I mean scents or motion or clothing, play a role in how those girls are going to react to you next time you go into it or that time. You don't want those dark, fuzzy clothing. You don't want strong scents. You don't want to be a smash and grab kind of beekeeper. They like slow zen-like motions. So how you approach that hive, they'll let you know next time if you did well, or even during that time you're in. Every time you're in an apiary, you ought to consider doing these things. Make sure somebody knows you're in the apiary. If you can't have an apiary buddy, at least know let your significant other or whomever you work bees with, let them know you're in the apiary. Have your cell phone accessible. Have it on you. Make sure it's an outside pocket too if you have to get to it. Dress appropriately. Dress appropriately for what you're doing in your yard. And for heaven's sakes, please wear a veil. Facial stings are some of the worst things that you can get hit with. Have your smoker lit and make sure you know how to use it. Use it properly. That is kind of your fail safe. If something happens, if you get a sting, you can always remove the stinger and smoke the area. Help cut down on the call to arms by that one guard bee calling all her sisters and half-sisters to defend the hive. Every time you go in your hive, have a plan. You want to know what you plan on doing so that you're not spending excess time in it and you get done what you got to get done. And I kind of alluded to this. You kind of want to be slow and deliberate in your approach to the hive. Slow motions, kind of not jerky, crashing, slow, easy, zen-like. Oh yeah, did I mention wear a veil? Always have facial protection. Manipulate those hives in good weather. primarily midday when the foragers are gone. You need to know when you close up that hive and return another day. Sometimes they just don't want you there. You don't know if you had skunks clawing at the hive the night before or raccoons were bothering them. They let you know. They'll let you know when it's too long that the hive's been open. If you don't have to do something and they're just in your face, banging on your veil, close it up, return another day. Smoke the sting areas as previously discussed. And if you're having one of those severe reactions, you need to know what those are, and I went over them rather quickly. Call 911. Don't wait and see if it goes away. It's not worth you dying by thinking it's nothing. Call 911. If you have an EpiPen, you're having the reaction, use it. Do not delay. Because again, beekeeping is not worth your life. Here's a few of the reference I did use, not all inclusive, but a couple of them. The Jamie Ellis article in American Beekeeping Journal in 2016 was actually an extremely good article. You can get it off the University of Florida, his link site, and it's under, I believe, additional resources. Great article with that. The Riddle article was also really good. And again, my goal is to educate you and make you aware, especially of a worst case scenario. My intent is not to scare you to death, but I want you to love your bees and treat them with the respect that they deserve. Thanks very much for your attention. Again, I hope this is helpful. And please remember, if you haven't had a reaction to a sting before, does not mean that you can possibly never have a reaction to it. And multiple stings are as bad as an anaphylaxis reaction to a sting. Thank you very much.